Hello and welcome. I'm Bas Tadros. I'm with Dr. Isaac Golden. This is our third session. If you've been following our segments of chats about the current situation and what's happening, Dr. Isaac Golden, welcome.
Thank you, Bas. Good to be back again, talking about another controversial topic, no doubt.
Absolutely. So today we've got the risk mitigation factor. How do you think our response has been to this situation? I know that, obviously it feels like a lot of it was knee-jerk reaction with the things that we've seen come across. Do you feel like it's been adequate in terms of a risk mitigation?
I've got two different answers to that, Bas.
Sure.
My original training was in economics, and I thought early on the economic response was excellent.
Yeah.
I remember my old father, who passed away many, many years ago, who lived through the Great Depression in the 1930s, telling me on numbers of occasions how the governor of the Bank of England actually came out to Australia and told them, don't spend any money. You've got to, that made the whole depression worse.
Right.
It affected hundreds of millions of people around the world, that approach. And then a wonderful economist, John Maynard Keynes, came on the scene and wrote seminal works which proved it was wrong. And so the approach now is that if the country is going through a downturn, the government needs to spend more. And then when the country's in really good times, the government can spend less. And this is what the government did. They anticipated many people being out of work initially with this, and they brought in some really good economic packages. So in that regard, the initial response, at least of the federal government, and to a lesser extent the state governments, I think was very, very appropriate. The health response, on the other hand, I think was very inappropriate. And we've alluded to this in the previous chat when I said that the people running the health response refused to allow Australians, and that includes Australian politicians, by the way, to have all the facts. And they continue to refuse all the facts to be allowed to be used against this disease. Because if we could use everything, every medical option against COVID, we would be in a far different situation now than we actually are. We'd be much, much better off. And that applies to every country on the planet. So there's a whole list of things which to us are pretty novel. So we've had lockdowns, social distancing, contact tracing, masks, and of course vaccines. So those 5 things are the core of the response. Given that the response neglects both preventative and treatment options used by integrative medicine doctors and natural therapists, qualified natural therapists all around the world. In Australia, you can be prosecuted if you get up and say, I can prevent COVID or I can treat COVID.
Right.
And, there have been many practitioners who have been given warning letters from AHPRA and from other regulatory bodies and the TGA in this country to make sure that people don't get to hear about things.
Right.
Sorry,
right.
Bas.
No, you're right. So I was saying, so their freedom has literally been stripped off them from having a potential solution to this massive problem that we're all facing.
Absolutely.
Wow.
And the problem with the freedom of the therapists to speak freely means that our freedoms as Australian citizens are therefore limited. And of those 5 things, that we're now very much part of our conversations every day with the lockdowns and masks, etc., I think some of those things make a lot more sense than others. Now, for example, contact tracing. I know that some people are really opposed to this because they feel that that's an infringement of their civil liberties. Why should Big Brother know where we are? Why should the government know if I go into a restaurant or I go into a bottle shop or a supermarket? And, you know, I can understand that on one level, but on another level, I can also understand why something like contact tracing, if there is an outbreak, really does help the people managing the outbreak to narrow things down to where exposure may be the greatest, to identify potential warning areas. So I'm not totally opposed to that.
Well, I am.
And
If I can interject,
are you? Okay, well, yes,
I'll
go
tell you
ahead.
why I am. We have not
Yep.
had a community spread of this virus in WA, yet they're making it mandatory for contact tracing in WA. And that doesn't make any sense to me. So it is completely against any human rights and freedoms. Why should people be made mandatory to check into somewhere where there has not been any community spread, not one community spread case
Well,
in WA?
I can tell you what the answer is.
Sure.
And that is that look at what's happened in Victoria, look at what's happened in New South Wales. That could happen in WA, and therefore if something got into WA and we do have contact tracing, then we'll be able to manage it much more effectively. That would be the answer from your Mr. 88% Premier.
Of
Is he
course.
still on 88%, Bass? I don't know.
God knows. God knows.
At the last election, he was.
He's on a huge campaign, and every day he's drinking a beer with somebody or having a burger with somebody and making new friends. And good luck to him with that. You know, we need someone that's personable, but we definitely don't
No,
need
but
a
it's good.
dictatorship.
What you just said is very good, because it shows that for every topic in this whole mass of topics, there are different points of view, and I don't have a problem with that.
Yeah,
Um, you and everyone else who opposes contact tracing on that, I get it. I understand why you think it is an infringement of civil liberties, and it is.
yes,
But it's one of the infringements which I think probably in some ways makes more sense than, for example, mask wearing.
I totally agree.
Now, yeah, and there will be plenty of people who would totally disagree with me.
Yeah,
But the only reason I'm raising a question about mask wearing is because there's a lot of medical evidence
mm,
that because of the size of the viral particles being significantly smaller than the size of the mesh, if you like, of the mask, they
yeah,
can pass through the
yes.
mask, most masks. Now,
I
there are
have.
masks where they can't pass through, but the average person in the street walking around with their mask, it's not providing really effective treatment. And there have also now been quite a few orthodox medical studies published in mainstream medical journals saying how people's health has been impacted by masks,
Mm,
and especially children,
yeah,
you know, and that's really where I'm most concerned about the impact, not only emotionally, because that impact has also been documented in orthodox medical journals,
yeah,
but the impact of mask wearing, but even just the circulation of impure air in a mask of an adult,
mm,
it can have a very negative effect when the evidence is not overwhelming. Now, I can understand why psychologically people who don't read the medical journals would think, oh, okay, if there's a barrier there, it'll give me protection and it'll protect others from me.
right.
It psychologically, it kind of makes sense, but when you look at the science of it, it
Yeah.
doesn't.
I had a scientist actually explain to me that a hair, for example, is 8 microns in size, and a virus like a coronavirus disease would be 1 micron. And to stop it with this mask, there's very little chance. It's like using chicken wire fence to stop smoke. You know, it's really not effective at all as a treatment or as a preventative. But the fact that that's been made mandatory as well is another encroach on human rights and freedoms. I think
I am.
giving
Yeah.
people the choice to wear them is fine. Giving people
Yep.
the option to wear them is completely okay. And especially if they're sick people or they're showing symptoms or something. And then I think that same sort of approach, closing this session about the mitigation and the risk mitigation factor and the response, I think it's been a across the board kind of response instead of being, well, who's affected by this? It's a certain age bracket. It's the elderly people, or people with comorbidities, or people with other issues. And we need to help them. And if we're going to quarantine, lockdown, maybe that's the sector of people that we need to be really taking care of and given a lot more attention to. Children are fine. People up until the age of 50 or whatever it is are fine. And so we let work continue. We let, going back to the economic response, maybe it is a good response, but maybe it's not required if we didn't have the overall lockdown, which has caused many other issues like smaller businesses being affected. And now, of course, that the economic stimulus is gone, you've got small businesses being closed for lockdowns that have been extended now in Melbourne, in Sydney, even in WA and in Queensland, that are no longer getting any incentives. So how are those people supposed to operate their restaurants or their cafes or their small businesses now that these incentives are gone? So I think there hasn't been an adequate mitigation, especially on the health sector side of things, which is where really the overall issue is here. There's just been across the board, and now there seems to be this dictatorship or this mandatory push for things instead of the liberties we have always known to have with democracy. And that, I think, is
Yeah.
the biggest issue.
So the thing with lockdowns for me is that they have been driven by health officials who have a very narrow and limited point of view about health.
Yeah.
And I've mentioned in some of my previous talks, Harvard University, their ethics lab there, their SAFRA ethics lab, who studied pharmaceutical drug cartels and their impact on all aspects of orthodox, if you like, mainstream health in countries around the world, particularly America, because that's where they were based, but it had implications for every other country, including Australia. So in other words, the health response, and particularly things like lockdowns, have been led by people with no training in the full implications of lockdowns. And these are people who very often, they may be wonderful GPs, they may be wonderful, medical practitioners in their area of speciality, but what they have no experience in the economic effects of what they're glibly saying, okay, we'll lock down for another week, we'll lock down for another 2 weeks. Because the politicians have no idea about most things, and I'm saying that it sounds a little bit like a broad brush, but it's reasonably true. The politicians have divested their responsibility to control what's happening to the health officials. And time and again, we've heard political leaders say, well, we're acting on the health advice. But the health advice is impinging on areas which go way beyond simple health. And the health advice, as I've said previously, has denied us the ability to use every approach, including integrative and natural approaches, to deal with it. Therefore, the health advice has been very poor on the health issue. It's been even worse when it comes to the economic side of things. So this is, to me, the real problem with lockdowns, that it's being led by people who are not the appropriate people to lead the full implications of the response. Now, we're recording this at a time where England has just declared Freedom Day a few days ago.
Right.
That's going to be an incredibly interesting experience. And by the time we finish these little sessions, it may well be that we'll have a session on England at the end, because, in another couple of weeks' time, we may find some really, really interesting experiences coming out of England, opening up from this, continual lockdown. And they may be very positive experiences, or they may be very negative ones.
Sure.
Either way, in England, they haven't been allowed to use the full range of options to both prevent and treat COVID. And their whole approach now would be that much safer, that much more successful if they had been allowed to. That's the point for me. And I will bore people endlessly by coming back to that point, because if we'd been allowed as a whole world community to use every approach in our armory against COVID, this could have been sorted by now to
Yeah,
a great extent.
and maybe it's a very good point to continue to press in every session that we have. I look at life as a husband, as a father, as a practitioner, in what I do, from a place of strategic. Whatever I do, whether it's working or not working for me, it was a strategy. And if I can modify the strategy, I might get better outcomes. And I've always utilized that when I was a kid, as a student, as a soccer player, in corporate, in whatever I did, everything is a strategy. And so looking at this global situation, we won't even call it a problem or a challenge for now. It's a situation. I'm wondering why people are not looking at every possible solution for a strategy. And instead, they're looking at only a number of strategies or solutions that are not helpful or preventative, and that may be causing more long-term issues down the track. So that probably wraps our mitigation response here. Thank you so much for your time, and thank you everyone for watching.
Thank you.
Cheers.